Hello, welcome to my YouTube channel. Today we're going to talk about a very high yield topic which is frequently tested on the board exams. And I'll give you some solid information how to tackle a USMLE style question and how to augment your score in the optimal way. So let's get started. So this is a 57 years old woman who is brought to the emergency department 20 minutes after a simple partial seizure. So I'm going to highlight all the relevant high yield information. So on examinations, she is having focal neurological signs, mild weakness of the right lower extremity, and CT was performed, which showed a 1.5 centimeter uniform and intensely enhanced parasagittal mass in the left frontal region. So which of the following is the most likely diagnosis? So I'm going to give you some time and then you have to answer it. So the correct answer is meningioma, right? So why meningioma is the correct answer and why the other options are incorrect or irrelevant or wrong. So first of all, I have given you some highlighted phrases here. So 57 years, it means she is an older female, right? She is a woman and she is 57 years old. So it means she is a female. So meningioma is more common in the older population and it is more common in female population as compared to male population. And then the presentation. So most of the tumor, they present with the sudden onset of focal neurological signs or sudden onset of seizure with progressive neurological sign or some headache, right? So this is a common presentation. So there is nothing peculiar about it. Uh, so except there is no fever. So you cannot think of the infectious etiology such as meningitis, right? And there is no headache and you cannot think of subarachnoid hemorrhage because in case of subarachnoid hemorrhage, at initial presentation, you're not going to have focal neurological signs, right? And the patient is going to be have hypertension. This which is not the case here. And CT findings are again very important because whenever there is a focal neurological sign after examination, after initial resuscitation, you perform a CT in order to detect either it is a stroke due to hemorrhage or ischemia, right? So, or there might be a tumor, right? As in this case. So you have to perform the CT. So CT findings are again very crucial and very important, and they can lead to establish the diagnosis. So you can see that it is a very uniform and intensely enhancing parasagittal mass. It means it is not invading, it is not enlarging, or it is not uh, crossing the midline, or it is not distorting the structures. Obviously, it is causing compressive symptoms, but I mean, it is not a very invasive and aggressive tumor. And again, this thing, it means it is the CT was performed with IV contrast, intravenous contrast. So the area of pathology is uptaking the contrast rapidly and prominently. So it means that obviously the tumor cells have higher metabolic activity, so they need more blood. And we are going to give contrast via blood. So the tumor cell, they are going to derive more blood. It means they're going to derive or absorb more contrast with the blood. So if there is increased contrast uptake, it means there is some tumorous activity going on. So which of the following is the most likely diagnosis? I told you it is meningioma. And why I have mentioned this, that left frontal lesion, because the meningiomas, they are usually on the surface of the brain, on the exterior surface of the brain, and they have a dural attachment, which is known as dural tail, and they are usually in the frontal region. So location is very important because we can see that glioblastoma multiforme is in the option. Glioblastoma multiforme can be present in the frontal region, but uh, glioblastoma multiforme is a very aggressive tumor, very invasive tumor. It is going to present like in a matter of days to weeks, and the patient is going to die within months, right? Furthermore, it crosses the midline, and when it crosses the midline, it means the tumor is not going to be uniform, and it is not going to be well circumscribed, and glioblastoma multiforme is going to be have a very aggressive tumor with multiple dilated blood vessels, with the hemorrhage, with necrosis, and with midline shift. There is nothing such in this clinical vignette, so you can rule out glioblastoma multiforme. Astrocytoma is a tumor of pediatric population, and it is a tumor which involves the third and fourth ventricular region, and it involves the posterior cranial fossa, usually the cerebellum, around cerebellum, right? So it is a posterior cranial fossa tumor, and it is not going to present in the left frontal region, and it is not going to present in the older female. It is because astrocytoma is a pediatric tumor. It is not a tumor of the older population. So you can rule out astrocytoma. Again, ependymoma. Ependymoma is a tumor which is derived from the ependymal cells of the ventricular system, right? So it is going to involve the ventricular system, mostly the fourth ventricle, third ventricle, and it is going to present with obstructive hydrocephalus features, like a severe headache, which is more prominent in the morning, and then projectile vomiting, and then some focal neurological findings in the later course of the disease, papilledema, and also blurriness of the vein. All these things would be the features of the obstructive hydrocephalus, and these are not the features they are given in this clinical vignette. And again, the site of involvement is in the left frontal region and not in the fourth or ventricle, and so this is against the typical presentation of the disease. So you have to basically think in your head, okay, so this disease or this tumor is going to present in such a manner, and in the clinical vignette the information is given in contrast to it. So you have to rule in and rule out a particular diagnosis based on the information present in your head and based on the information present in the given clinical vignette, and you have to compare and contrast the information, and then you have to reach a particular diagnosis. And by practice you will learn, you will master this thing, and you would be fantastic with the passage of time with practice. And schwannoma is a tumor. Again, it is a tumor of the older population, but it is again going to involve the posterior cranial fossa around the third and fourth ventricular region. So mostly schwannoma is going to involve the like if you have a schwannoma, so they are going to give you a cross section, and they are going to give you a bilateral tumor along the pontocerebellar angle, right? Cerebellopontine angle, where the seventh and eighth cranial nerve arise. So schwannoma is going to involve posterior cranial fossa at the junction of the cerebellopontine angle, right? And where the seventh and eighth cranial nerve arise. So we can basically deduce the presentation because of its close relation with the seventh and eighth cranial nerve. So schwannoma is going to present bilaterally usually, and it is going to be associated with neurofibromatosis type 2, and it is going to present with progressive bilateral sensory neural hearing loss because of the compressive effects of the tumor, and it is also going to have some tinnitus and some headache and some focal neurological signs. So all these features are not present in this case, and again the site of involvement is different, so we can rule out this option too. So this was all about the CNS tumors. I hope you enjoyed this video. Please give this video a like, share with your friends, and subscribe to our YouTube channel. Thank you so much.